Welcome to Chapter 5 Practitioners and the Workplace Settings. There's a lot to jump into for this chapter, but it is really fascinating stuff. A lot of it we've touched upon already, but it gets into a lot of the licensing, the scope of practice, and if you are considering a career in the health field, this is some really good information. So, what are we going to learn in this chapter? The first thing is we're going to describe the various ways in which individuals working in healthcare are categorized. There's various different levels of all sorts of health practitioners, and we're going to learn about how those categories are kind of come up with. We're going to outline the purpose and benefits of why these health professions are regulated. We're going to discuss the role of educational requirements for various healthcare practitioners and professionals. We're going to describe the practice settings in which healthcare is delivered, and we're going to summarize the current state of primary healthcare in Canada. Okay, so who is the first question? Who delivers healthcare and where is it delivered? And those things are ongoing and they continue to change. So, healthcare in Canada is provided by three broad categories. The first one is the conventional or mainstream medical practitioners, and we all know those, the doctors and nurses, the ones that are heavily regulated and that we find everywhere. Those who practice complementary or alternative medicine, and then the informal workers. And there's a large group of these informal workers that are volunteers, friends and family, that are doing a lot of the healthcare that isn't necessarily taking place in a clinic or a hospital or a traditional healthcare location. Okay, so where is it happening? In hospitals, residential care facilities, there's been a lot of those in the news lately, rehab centers, community care facilities, hospices, a variety of clinics and primary care settings, as well as the home. A lot of people are being taken care of in the home. Okay, trends in healthcare delivery. So in 2014, which is a long time ago now, reported that 4.5 million Canadians did not have a physician, a family physician. And I'm sure that it is worse now. It has not gotten much better. But to address this issue, all regions are experimenting different ways to deliver healthcare. Patients, medical home, PMH, professional collaboration, and community-based healthcare. The other thing that has helped tremendously over the last little bit is the ability to meet doctors online and over the phone has been really ramped up, and that has helped tremendously in alleviating a lot of the pressure and trying to see a doctor when you need to see one. Okay, so we touched on this briefly. Here are those categories of healthcare practitioners. We have the conventional healthcare practitioners, and those include the most popular types of healthcare professionals: physicians, nurse practitioners, midwives, nurses, dentists, right? That is the conventional medical system, and those are the conventional roles. Allied health professionals include dental hygienists, dietitians, optometrists, psychologists, and then the complementary or alternative practitioners, and those include indigenous healers, naturopath doctors, and massage therapists. Okay, so conventional medicine is frequently referred as orthodox, mainstream, or traditional, or even Western medicine. And this conventional healthcare, this is where they diagnose problems, they treat pre-diagnosed health problems, they render technical, therapeutic, or supportive care with scientifically proven therapies, medicine, and surgery. So this medicine or this stream is based in robust scientific studies. These procedures that we go through at hospitals and with doctors go through a rigorous process before they're introduced into mainstream medicine. So this is those very conventional medical practices. The complementary or alternative medicine on the other hand, is an alternative option to this traditional Western medical way of doing things. What is considered alternative? It is somewhat fluid, right? Like it isn't, it's always changing. And it's people that, as we discover new medical practices and people might travel different parts of the world or different communities, there are a number of different alternative types of medicine. What is considered standard in one country or even a province or territory, it might not be the same in another. That is true. There's various practices that happen in other countries that are not approved here in Canada, and vice versa. In most alternative therapies are not covered by provincial or territory insurance. Why? Because the only thing that is covered under the Canadian and provincial healthcare system are procedures that are deemed medically necessary. And if it is deemed medically necessary, you can go to a hospital, you can go to a doctor, it's covered. But if you want to explore alternative ways of healing, alternative ways of treating, alternative ways of diagnosing, that you have to pay out of pocket because it is not considered medically necessary. Okay, alternative medicines. Critics of alternative medicines believe that treatments should be scientifically proven before they're used, right? It's also called evidence-informed or evidence-based approach. So don't start prodding people and giving them different types of herbs and treatments and oils until they know that that stuff is approved. A significant number of, despite that, there's a significant number of Canadians that use alternative medicine. This may be due to many factors, including, I don't know, maybe disillusionment of conventional medicine, meaning they've kind of given up on it, difficulty getting appointments with doctors, cultural beliefs or influences, information available on the internet, and many more people are actively participating in their own healthcare treatment options. Okay, so chiropractic is really, really interesting because they don't really have a good definition of where it belongs. Is it conventional, complementary? Is it alternative? So chiropractors are doctors of chiropractic medicine. They diagnose and treat a wide range of conditions that deal primarily with disorders of the spine, the pelvis, extremities, and joints. They take a holistic approach and they use various non-invasive therapies. Chiropractic medicine is still considered by many on the cusp of alternative, right? Many people say, I don't really feel like this is traditional medicine or that they necessarily are a doctor. The relationship between chiropractors and physicians is variable, meaning that it's not necessarily a great relationship. A lot of doctors feel like chiropractors don't have any kind of right to be considered a doctor, I guess, is the best way to put it. Okay, so regulation of healthcare professionals. How are healthcare professionals regulated? So there's various educational standards. As you know, if you're considering going into the health field, you know that there are courses and exams that need to be completed. There are provincial and territory examinations. There's a scope of practice, which says, okay, after you've completed the education and the exams and the practice, there are certain acts and skills that you'll be able to perform and other ones that you will not. The curbing of individual practices, if standard are not met. Yes, formal complaint process. So if you are a regulated profession, there is a way for you to complain if you don't feel like someone is living up to the standard. I know there was a dentist recently in the area that one of our students went to, and they didn't do a very good job with their filling and gave them migraines and nerve damage and all sorts of stuff. And then upon further investigation, the student discovered that there had been a number of formal complaints about this dentist. Those regulatory bodies have to follow up on complaints. They use title protection, meaning that if you if you continue to screw up, they will remove your title. They'll kick you out of the club. They will no longer allow you to practice medicine. And this helps regulate competence and quality assurance. You know that if there's a doctor in Canada and they continue to screw up, that eventually, at some point, hopefully, enough people complain, and then that doctor loses their license. Or nurse or dentist or any other healthcare professional. It doesn't have to be a doctor. Okay, performing controlled acts. What is a controlled act? A controlled act is something in which a qualified practitioner may do it. If they're not qualified, they're not allowed to do it, right? Certain things like injections, stitches, giving medication, all of those things are controlled acts. And controlled acts are identified and regulated by health professionals, the RHA or equivalent jurisdiction. Oh, here's some examples: giving an injection, setting a fracture, giving someone gas for pain, prescribing medication. All of those things are controlled acts, and you need to have a license to do them or be under the supervision of someone who has a license, which really means that you're doing it under someone's license anyways. Okay, here are some exceptions. Most provinces and territories allow controlled acts to be performed by competent yet unregulated individuals, including, here's some examples: a person with appropriate training, students learning to perform that act, a person such as a caregiver who's been trained, and an appropriate person designated to perform an act in accordance with a religion. Those are some exceptions to allow individuals to perform certain controlled acts. Okay, what is a delegated act? A delegated act is, by definition, it allows someone who's regulated in a regulated profession to authorize someone else to perform the act. It transfers their legal authority or permits another person to carry out the controlled act that otherwise would be unauthorized to do that. So certain procedures a doctor can delegate to a nurse and allow them to do it because they're authorized under their medical license. Although guidelines and protocols for delegation of medical acts vary across Canada, in general, the delegated act must be clearly defined and supervised accordingly, right? Someone is in the room watching you do it. They have the license. So there's a very strict protocol to how that happens. The delegating healthcare professional, the delegate in the facility or the environment in which the act is performed share responsibility for the act, right? So the person watching the person doing it also shares responsibility that they're not screwing things up. So non-regulated professionals and occupations. People who work within non-regulated occupations do not have federal or provincial legislations governing their occupations. So this is why it is dangerous sometimes going to someone who practices alternative medicine, because no one is following up with them and no one is making sure that they're doing things correctly or that there isn't even a procedure. So this is why sometimes going the alternative route may not be the safest. Like regulated professions, many non-regulated occupations have professional organizations and bodies that award certification when a person completes a set of written or practical examinations. In a lot of cases, they have to do both. Okay, would-be physicians must complete 2 to 4 years of undergraduate work. Then you have to write your MCATs. Once you do that, you apply to the Canadian medical schools, and if you get in, guess what? You have another 3 to 4 years of study followed by a residency. It's a long, long road to become a doctor. Here are some specialists within Canada: family physicians, people who work in emergencies, people who work with the heart, people that work with reproductive organs, people who work with the nervous system, the mind, respiratory system, surgeons, radiology. They go on and on and on. There's all sorts of ways that physicians can specialize within Canada And this is certainly not the entire list. Okay, registered nurses, which a lot of people in this program are striving to be. All Canadian jurisdictions, except for Quebec, because they always want to do their own thing, require a bachelor degree in nursing to enter the profession. The RN usually assumes the most complex components of nursing care and also a variety of leadership roles, both clinical and administrative. Many hospitals and other facilities employ RNs only in specific areas such as intensive care, where a special skill set is needed, and particularly in the assessment and decision-making fields or areas and where those skills are critical. So advanced practical nurse, there are two categories of advanced practical nurse. First, nurse practitioners, and those are registered nurses with advanced training and skills. And then clinical nurse specialists are nurses who have a master's or a doctorate degree in nursing in addition to wide-ranging nursing knowledge and clinical expertise. Like, this is the great thing about going into nursing, is that you can continue to progress in your profession, and there's another level that you can achieve if you desire to do so. Licensed practical nurses, or LPNs, called registered nurses, in Ontario have completed a 2-year diploma program at a community college or private college. The skill set and scope of practice of LPNs have expanded dramatically over the past few years, assuming many of the responsibilities that were formerly limited to RNs. This is very controversial, but it is happening. And the practical nurse collaborates with RNs, other members of the healthcare team, to render patient care. So this is a very controversial topic, but you can see why the government is doing it. They're trying to say, let's get more nurses into the field. Let's not wait around for them to complete 4 years. Let's try to expand the scope of practice so people who complete the 2-year diploma can do a lot of the things that the person who's completed 4 years only previously was able to do. Okay, pharmacists. We've all had experiences with pharmacists. Licensed pharmacists dispense medications. Of course, this is controlled here in our country. Some countries I've been to, you can just go and buy whatever drugs you want, but here that is controlled. The practice of pharmacy must earn a bachelor's degree, complete internship, and successfully pass an examination. Many jurisdictions allow pharmacists to write prescriptions under designated guidelines, and the goal of adding new responsibilities to the scope of practice of pharmacists is to reduce the volume of work of doctors, clinics, emergency departments, and increase patient access to frontline services. So they're trying to expand the services that pharmacists are able to provide, because then you don't necessarily have to go to a doctor every time you need to refill a prescription, perhaps. Okay, midwives. Midwives provide prenatal care before the baby's born, deliver the baby either at the patient's home or in a birthing center or even the hospital, and they provide newborn care up to 6 weeks after the birth. The care of a pregnant woman must be turned over to a physician if the pregnancy becomes high risk or they show signs of other problems during labor or delivery. Optometrists and optometrists are doctors of ophthalmology, and they're licensed. They can assess eye function and conditions, prescribe medications to treat the eyes, and prescribe glasses and contact lenses. Opticians, on the other hand, they fill prescriptions, they fit glasses, and they provide instructions related to contact lenses and glasses. Osteopaths. Osteopathy incorporates a holistic manual approach to diagnosis and treatment. It's considered musculoskeletal system and its relationship to the body. Osteopathic physicians are trained in the United States. In Canada, it remains an unregulated profession, right? And graduates of osteopathy schools can practice manual practitioners or therapists. So what that means is it is one of those fields that is not regulated. It is not licensed. So there's not anywhere you can go if it goes wrong to complain. And their scope of practice is not heavily supervised like the other health fields. Okay, This is talking about foot doctors. There's a number of different of people who help with feet. Podiatrist is a designation, and they specialize in foot disorders, sport injuries, deformities, infections, and anything to do really with the feet. And in Canada, the program is offered in Toronto. There's only one school. I knew this. Someone else was telling me that there's only one school in Canada that you can do this, and it's super competitive to get in. And if you do get in, there's lots of opportunity for you because there's not a lot of podiatrists. Okay, personal support workers. Most jurisdictions recognize a category of healthcare workers who provide basic care, carrying out auxiliary duties for patients. The title and educational requirements vary. Not all personal support workers programs are the same. These healthcare providers work under the direction of other members of the health team. They work in long-term care facilities, home care organizations, adult daycare, senior residence, and group homes. So if you are a PSW, there's lots of opportunity for you. You can work in a wide variety of places. Psychologists, of course, work with families and individuals to treat emotional and mental disorders. They don't have the authority to prescribe medications or perform medical procedures. And often a psychiatrist and a psychologist will work together because the psychiatrist can't help with the medication. Respiratory therapists work with the respiratory system. The program there is 3 years of university, and they specialize in your respiratory system. If you have difficulty breathing, you need to use a respirator, all of those types of things. They set up oxygen therapy. They must have been very busy during the COVID crisis here because that was largely a respiratory ailment. Physiotherapists are a regulated profession. This is why it's difficult to get in, why there's a number of exams, and it's you have to follow all the rules. Limit and they improve the physical impairments and disabilities, and they prevent and manage pain. And most jurisdictions cover physiotherapy services under specific conditions for a limited time frame. So you can use OHIP, right? You can go to a physiotherapist, and the government will pay for that because it is deemed necessary in some situations. Occupational therapists is another regulated field. And occupational therapists help individuals who have been in accidents. They might have disabilities. They might be disabled because of a disease. They might have emotional developmental problems and aging. As we get older, it gets harder to move. So occupational therapists can help you with that. Health information management professionals hold a designation of a certified or of a CHIM, and that stands for Certified in Health Information Management. And they help with all the information to deal with the health field. They deal with the data, they deal with privacy, they deal with electronic health information. And this is becoming more and more of a field in demand because we're going largely electronic with a lot of our health information. Health office administration. People in this role must have sound knowledge of pharmacology, diagnostic, and laboratory testing. This is essentially all the health administration, right? They must practice settings would include like a doctor's office or hospital, long-term care facilities, and administrators must have the ability to multitask because there's a lot going on in these facilities. So they want people who are flexible and friendly and empathetic and supportive and comfortable around individuals experiencing health problems and a lot of pain. So this is often the backbone of our healthcare system is the administrators that help people in the front line, when they first arrive or are being discharged and everything in between. Laboratory and diagnostic services. There is a whole huge field here that people can go into in diagnostic care. It's highly specialized, and there's programs here at Georgian in which you can go in and learn how the machines work and learn how to read stuff. But this is a big field for sure. And it includes highly qualified individuals, including physician medicine specialists, right? Like some people who go in this field are doctors that are just reading scans, and obviously a lot of technicians and technologists. Here is a huge part of our healthcare system, the volunteer caregivers, and sometimes this is just family and friends who volunteer to help either people in their community or relatives. And again, this is a tremendous support for our healthcare system, and it would collapse without all of these volunteers. And with current shortages in all the categories in healthcare, and this is why it's such a good field to go into, many patients depend on these volunteers to help them. The hours of care provided by these individuals is uncountable, and the output is unequaled, and the stress is phenomenal. Yeah, they put in so much time and effort and get paid nothing to do it all. And many ill people could not manage without these volunteers. It's so, so important. Okay, practice settings. The need for home and community care is increasing for all sorts of reasons. The objective is to reduce or avoid time in hospitals because there's so many people who have been in hospitals for so long because they don't have the health care or support at home. Home care is provided for individuals with varying health issues, including acute or chronic issues, complex health needs, palliative care, respite, and rehabilitation care. Urgent care and walk-in clinics provide non-emergency medical care. Obligatory care encompasses several different types of facilities, clinics, day surgeries, emergency rooms. There's all sorts of places you can go. Outpatient clinics offer services to meet unique needs of a particular area. And mental health clinics respond to specific needs of individuals with mental health disorders. Harm reduction sites or clinics are guided by strategies, practices, and procedures that reduce harm to individuals caused by substance abuse or addiction. Again, this is a very controversial issue. A lot of people don't want these types of clinics in their neighborhood. Methadone clinics, there's been big debate about Barry, about putting these in. They treat people who have been addicted to opioids. And nurse practitioner-led clinics provide care for individuals who do not have access to primary health care providers or primary health care team, which is also a growing trend. Why clinics make sense? They're cost-effective, they're timely, fewer patient visits, and they're convenient, and they focus on patients. Primary health care issues, there's a number of them. Thousands of Canadians do not have a primary care doctor. We've talked about this earlier. It is a huge issue. Strategies to facilitate same-day care access, the use of multidisciplinary teams, extended hours, after hours, the use of email and communication technologies. This has helped a lot over this year for sure, the use of technology in the phone and the computer. Canada has invested heavily in primary healthcare reform initiatives. Primary healthcare groups, age groups of healthcare professionals who work together as an interdisciplinary team, apply to provincial and territory governments for approval, and may require a certain percentage of patients who agree to become part of a practice. This is called rostering. There's lots of telephone support now that you can get. You can contact a doctor relatively easy over the phone or the internet, which has been a huge change and has alleviated a lot of stress in the system for sure. Okay, so that was an overview of practices and professions in the healthcare system. There's a lot of information in this chapter. Most of it relatively straightforward though, right? Like nothing is super complicated. Hopefully you found that information useful. And if you have any questions, as always, please do not hesitate to reach out and ask. Read the summary in your textbook at the end of the chapter. I find them to be very, very helpful, and know that it's really these learning outcomes. If you know the answers to these questions, you're in great shape.